Welcome to Becoming Parents Podcast. I'm your host, Jennifer Campbell. I'm a doula in Washoe County, Nevada, a Medicaid provider, a lactation educator, childbirth educator, and mom of 18. You can find me and connect on doulainreno.com. Remember, give a shout out to those who are brave enough to share their stories with us on how they have become parents. Let's dive in. Welcome to Becoming Parents Podcast. I am super excited today to have Dr. Dawn Kingston on. How are you?
Oh, very well, thank you.
And I asked you, I usually don't do this, but I really want to read your bio because I'm so impressed and proud of the work you're doing. So I'm going to go ahead and do that. Dr. Dawn Kingston is an award-winning researcher and mental health clinician who has worked in medicine for more than 25 years. 13 of those as a registered nurse in a neonatal ICU. She holds a master's in nursing and a master's in counseling. She also holds a PhD in mental health from McMaster University as a postdoctoral fellowship in mental health from the University of Manitoba. You're all Canada. She's a professor in the Faculty of Nursing at the University of Calgary, the inaugural holder of the Lewis Hole Hospital for Women Cross-Provincial Research Chair in Women's Mental Health, and the first Canadian chair in women's mental health at the Lois Hole Hospital. She's been awarded the National New Investigator Award from the Canadian Institutes of Health Research for her work in maternal mental health. Dr. Kingston and her team are developers of the Hope 3.0 digital mental health platform for women, the first women's only mental health resource offering online screening and assessment tools, information, and courses related to a variety of life situations to support women. And you live in Alberta with your family, and you've written a book called Your Brain on Pregnancy. I'm just wildly impressed with what you've done. So thank you, first of all.
Thank you, Jennifer. And honestly, when I sit here and I hear you read that, I think, who is she talking about?
What a cool woman.
Yeah. Thank you for having those
Yes.
things. And I do have to say, I have had the same team, which is very unusual in an academic environment, since 2012.
Wow.
And so, this group has been dedicated from the beginning. And I think we work out the magic of women's health. We relate, we practice it in our team. And I'm so proud of the team. So I have to just, honor them before going on.
Mm. Well, it does. I mean, it takes a village, right?
Yeah.
So how phenomenal, though, that since 2012, it's been the same team. That really shows how well you work together and the priority of this work to you. I'd love for you to jump in and share your parenting journey. I know that's probably impacted. I don't know if nursing came like which came first, chicken or egg. We're here. But you can kind of take us on your chronological journey of parenting and your profession, I guess. I'm so curious to hear.
Mhm. Wow. Okay. I'll just start by saying, Jennifer, that I did lose my husband a couple of months ago this summer,
Oh,
very unexpectedly. So, thinking about my parenting journey is a little tender at this point, but I'm really happy to do it because I'm learning that a lot of good things happen in the tender moments. And so, let's see, nursing came first.
okay.
Um, and I was working in a neonatal intensive care unit. And I remember at that time, sometimes felt like a little bit of a, square peg in a round hole because lots of neonatal nurses love the action, the really
Mm,
sick babies and the very life or death situations. And I really loved I loved the relationships with the parents. I loved helping the parents
mm,
cope with what they were going through. I wanted to ease their pain as they flew 3 hours away and leaving their baby, because they had to return to work or whatever. But part of that was also my husband and I were going through an infertility journey. And so while I was in the neonatal unit, seeing sick babies who were the very much desired children of parents who had gone through infertility, in
yeah.
vitro babies that died. I still remember this. one set of little boy twins. They were 23 weeks old. And I remember I was newly pregnant at the time, watching these little babies die. Basically, I was the nurse at the bedside, helping the father and the mother as they cuddled these dear babies and just really waited for them to pass. And so, my nursing journey was very much part of my interest in how do you, how do you help the emotional needs of families who are dealing with traumatic things. And so I guess that was my sort of my professional kickoff. And, my broader interest in mental health then happened when I had an obstetrician colleague who said, "You should do your master's, Dawn." And I thought, nobody in my family's even gone to university.
Right.
The concept of that was just not in my plan. Anyway, he wrote the letter of support and off I went, did a master's. And by the time I got to my PhD, I was very interested in how does mental health relate to prematurity and other infant outcomes. And as I discovered, it wasn't just about mental health, or just not just about stress, which we knew a lot about for 20 or 30 years and the impact on children and parents, but it was also stress, depression, anxiety, and pregnancy. And it wasn't just prematurity, it was child development, it was the family relationship, family as a unit, it was all kind of children's physical, emotional, and developmental outcomes. And so that's how our team really kind of kicked off to think about, well, okay, first of all, there's a great big issue here. And secondly, nobody's really doing anything about it. We're not screening women, we're not treating women, we're not asking questions about mental health on any level, not in pregnancy, postpartum at the time, not in a well woman's visit, not in
Mhm.
any checkups. So mental health was just really coming under it was underground. It still is underground.
I agree. As a doula, I got special certification in bereavement because, and adoption
Okay.
and surrogacy, because I lost three pregnancies and four babies. And when you go through that and you realize people don't talk about it, you
Yes.
never want another woman to feel unsupported. I also went through infertility, so I want to go back and ask you about that journey because talk about a time that you need a mental health screening. You might not like I didn't have any mental health issues going into infertility. But
Yeah.
I'd have to say 10 months later, 7-day surgeries, max on Clomid and Prevera.
Yeah.
I think through the process, we should have mental health support because,
Yes.
like, as a woman starting down the infertility journey with no mental health issues, I had
Yeah.
no idea the two by four of emotion that was going to hit me broadside. And absolutely no support in that. And
Mhm.
I could see how it could potentially be really devastating emotionally, just being on the level, like when you're on 250 milligrams of Clomid and
Mhm.
Prevera I mean,
Yeah.
functioning through that is such a task, right? So I don't know why they don't have mental health screenings and then required support through the infertility process. That would at least set up those women who have gone through that to understand the mental health support that's needed through pregnancy and postpartum, because we don't talk about it at all. What was your experience yourself with infertility and that
Oh,
situation?
yeah, very similar from a support perspective. My husband and I had tried for 7 years before we
Mm,
actually seeked help and or sought help. But I remember I remember actually we it was such a strain exactly because every month it's such a disappointment, isn't
mhm.
it? It's such a circle of disappointment and heartache. Every Mother's Day, I remember thinking, we'd go to church and I'd say, I can't stay for the, Mother's Day lunch and I can't do this. I can barely do Mother's Day at this point because it's just I love the way you said two by four. It's such a slam against everything
Mm,
you want and everything that other people seem to have and have it easily. And the
yeah.
journey is so desperately difficult. And even my boys are 30 and 31 now. So, back then, the idea of emotional support just wasn't even thought of at all. It
No.
wasn't part, wasn't on the radar at all. I think now I can see like Fertility Alberta is a new nonprofit organization that I've had a little bit of connection with, and I can see that there is more awareness around the emotional journey that it takes. But at the end of the day, Jennifer, I think that our biggest struggle was you don't know what kind of ending this is going to have, right?
Yeah, it's crazy. And I only went through I tried for a year and then went through a year of infertility, so I was lucky. And when he said IVF, I said I'm out and I ended up getting pregnant. So by fluke off his schedule, I remember looking at him at one point and saying, maybe this isn't all in your book. Like just this is such a crapshoot, like he's like,
Oh,
I don't know
yeah.
how it happened. And I'm like, it's not in your book, but it's it really is it's such a huge struggle.
Yeah.
I'm glad more's being done now. I think we talk more. My daughter is now 32, so I went through infertility 33 years ago. And I think the
Mhm.
sad part for me is she can't have children. She has a lot of the same issues that I had. And the treatment would be it's exactly the same for her as it was when I was getting pregnant to get pregnant with her.
Yeah.
And like we haven't made a lot of advances in how things are done, the process, the surgeries, the medications. And I think in over 30 years, why hasn't more been done in this? I do think you're right. Some of the mental health is being addressed, which is good. Take me through, you have two boys.
Yeah.
So the second time, did you have to go through infertility or did your body get kicked
No.
in?
And what I understood, because Joel was born 19 months later, and so
Okay.
on our first son's first birthday, that's when I found out I was pregnant. And my husband and I carried on like we always had, because why would we think it would be any different that we'd have a second child on our own, right? So we just
Right.
carried on without birth control, merrily going as we always did. Um, yeah, so he was born naturally, and that was yet again a different experience. I was gonna say, Jennifer, what our team is starting to circle around a little bit here. Um, some of the newer thinking around mental health is not framing, depression and anxiety as a disease, but
Hmm.
rather as symptoms of something bigger that's happening. And this is really, there's some lovely, lovely work happening on this in the US, and we're
Mm.
connecting with other people in around this, some, neurologists. But when you think about just the dysregulation of the body hormonally, and then is that related, and we believe it is, to brain and nervous system dysregulation? And so if we frame
Wow.
mental health as brain and nervous system dysregulation with the symptoms oozing out being depression and anxiety. So they're a symptom, just like a fever is a symptom of a flu, depression and anxiety, a symptom of dysregulation.
Mhm.
Then would fertility open up if we were to help women, instead of just thinking about the symptoms, to actually get their brain and nervous system regulated? And that's kind of
Wow.
the direction. We've talked about this in the book a little bit. And actually, the book was supposed to be basically written, and then I thought we can't go forward without really wrapping in the newest and best data that we know about neuroscience, which is this idea of dysregulation. Well,
Hmm.
how does dysregulation happen? Well, can happen from childhood trauma, childhood circumstances, can happen as an adult, traumatic experiences. And when we think about trauma, I love the way that Bessel van der Kolk talks about it as being something that happened to you, but continues to light you up in your daily life. It doesn't
Hmm.
have to be being in a war or being a veteran.
Right.
It can be being ignored,
Yeah.
which lights your brain and nervous system up so that you feel unsafe, right? So anything
Yep.
that puts us into that place of threat and unsafety. So on the issue of infertility. We do wonder in our team whether if you could regulate women's brain and nervous system, whether that might regulate them with all the systems that are needed to get fertility in.
That is fascinating. Um, that's really fascinating. I love that. And I believe it is a symptom. I think that's something that's changed from our generation, maybe where it was something that you had to deal with. It wasn't who you were. And I've
Mm.
seen a trend changing where if you have depression or anxiety, that's just who you are. And I think it is a symptom. And that means that just like the fever with a cold, it's something that you can work through and minimize or eliminate. There's a statement about the US, the American Psychiatric Association.
Yeah.
Issued the report here in the US saying that their high rates, alarmingly high rates of perinatal mental health conditions. Do you think that the rates are going up and or is it that we're more aware of them or
Yeah.
both?
You know, we do not we do not have the data to tell us if it's going up.
Mm,
You know
yeah.
why? Because we're only collecting data. Oh, actually, I'll go back for a second. We're only collecting data largely at one point at this time. Like we might collect it across pregnancy, but we're not collecting it across generations at this point. Our
Okay.
knowledge of perinatal mental health isn't that old
Yeah.
that the data reflect that. However, I'm just thinking about this now. There's a really, really neat group of researchers in the UK who have for years been studying this single group of children and their mothers. They've started in
Oh.
pregnancy and they follow, did questionnaires on them a couple times during pregnancy. And then these kids are now mid 20s, I think. It's called the Avon study,
Mhm.
longitudinal study of parents and children. So I'm just thinking about it now. I think I just came across an article that talked about the children of the mothers that had mental health problems in pregnancy there were more of them that had mental health problems. And so I think that they have started to uncover something. But
Mm.
again, what I think about that, um, dysregulation can be intergenerational. When you
Yes.
have, stress or in pregnancy, anxiety, depression, your child, and it's untreated, your child can be a little bit dysregulated. That can happen generationally, not through any fault of a mother or the child, just because a dysregulated nervous system goes forward. And we're
Yeah.
just covering all of this.
Yeah.
Um, yeah,
I would love for you to tell me the connection. I'm guessing that there's a connection. You had your two boys, you had
yeah,
been in the NICU.
yeah.
What changed with your job, and how did parenting your own boys change your profession, or did it, or the direction or trajectory? At some point, there have been shifts, and I'd love to learn about that.
Yeah, I think well, first of all, our own struggle with just getting pregnant,
Yep.
wondering about the relationship between, for example, stress and infertility. But I think, our my husband and I came from fairly, it's such a good word, dysfunctional backgrounds. And we really wanted things to be different for our own boys. We wanted our family to be different. We wanted to
Yeah.
parent differently. We wanted our parenting story to look different, healthy. So I think part of my work is about helping families, supporting families to have the best chance.
Mm.
The mothers, the partners, the children, to give them the best chance. Yeah.
There's been a lot of change in that I've noticed. I did foster care, and so I did adoptions, drug babies, and now there are so many transitional living programs where women who are addicted to drugs, have substance use disorders, can live and get clean. However, they have to take something during pregnancy so that they don't lose the pregnancy itself, but they're taking medication throughout their pregnancy in a monitor like Suboxone, and they're being monitored. And I always feel like, there are so many positive changes where back 30 years ago, if you had a mom who was drug positive, CPS came in and took the baby, and I was seeing those kids, right?
Mm,
And now they're managing their addictions, they're managing their situation, they're giving them the support that they need so that they can go through their pregnancy delivery and the baby's never removed. And
mm,
then the additional supporting information on the benefit of breastfeeding in those situations and the help it has on the baby with withdrawals. I do feel like there's a lot of forward momentum that's positive. And in the end, similarly, it's like we're doing everything we can for this family, this individual to be successful. If they're not, we've done everything that we can, but the rate of success in keeping these families together is considerably higher. So
mm,
even in really tough situations, instead of just passing judgment and taking those kids away, we're actually doing a lot more work on the other end to try to keep things together and get people healthy. And so I'm glad that there is like a way to do this better. That's one way to do some things better potentially. So I do see a lot of work on that end. And in those situations where they're more controlled, there is a lot of mental health support
mhm, mhm.
because those are babies at high risk, right?
They are. And
Yeah.
I guess what I think about too, Jennifer, is this is so relevant when you think about the work that Gabor Mate has done, or Bessel van der Kolk, or Dana Fisher,
Mhm.
some of the people that are working with trauma, which, yes, might have started with, in war veterans,
Yeah.
but which inevitably trickles down to just the average person's life because all of us have experiences in our background that have been wounding. And I think
Yeah.
about some of the young women that, it wasn't random that they turned to substances, or abuse substances. There's a story there, there's a history, and the history deserves some attention and healing, doesn't it?
Yeah.
I think about exactly what you're saying. I remember I worked as a nurse clinician for a few years in a community hospital, and under my portfolio of education and supporting the nurses was the neonatal unit. And I remember one night they were understaffed, and so I went in to help. And there was a young woman, she was 14 years old, and she had a baby. And, she had addictions. And the nurses generally treated her like crap.
Yeah.
I remember the night I was there, it was Friday night. She came in about 9:30 at night with her boyfriend. And they came in to see the baby. Well, why didn't they come in regular visiting hours, which they were often criticized for? Well, because they had to wait for somebody to drive them. So
Mm.
by the time they got all their ducks in order to get up to the hospital, it was now 9:30 at night, and I still remember this nurse sitting at the desk and barking at them from the desk and telling them not to touch the baby and not to get the baby out. And I went over and I opened the isolette, wrapped the baby up, gave the baby to them. And that's the first time that mom started opening up about her addiction and about how
Mm.
she had been on, drugs for a long time before she became pregnant. It was the only way she could cope. It's the only way that was available to her to cope. And so, yeah, I think the backstory, all of
Mhm.
us deserve healing from our wounds, don't we?
Yeah, and I love that you've brought up a couple times the generational trauma. There's a story about a woman who cuts the end off the pot roast to cook it, and she tells her husband it tastes better. And he's like, why do you do that? My mom does it. It tastes better. So he asked the mom, why do you cut the end off the roast before you cook it? And she said, it tastes better. My mom always did it. So he goes to the grandmother and says, why do you cut the end off the roast when you cook it? She said, oh, the oven I had was too small to fit it otherwise.
I love
Yeah, that's generational trauma. I mean, that's a funny illustration, right? But
Yeah.
like when you really go back and get to the bottom of why we do things or why we feel this way and what our belief systems are,
Yeah.
And you ask the mom and you ask the grandma and you go back and realize it has nothing to do with how it's filtered down, but you've taken on this trauma of the pot roast, right? You've taken this
Yeah.
on
Yeah.
because that's what you think you're supposed to do. But that's a funny story, but that works in many ways through generational trauma where we don't even realize we're taking on something that doesn't even belong to us.
Yeah.
Tell me about, I'd like to segue into um you have the Hope program and you work with pregnancy, postpartum, menopause. I'm postmenopause. That's exciting. That was terrible. Um, Grief and loss, life challenges and trauma, relationship issues. And you and your team are leading the field using an technology for screening and therapy
Yeah.
so that women can get help whenever, wherever they need it. And I think that's probably got to be massively groundbreaking.
Well, Jennifer, I still remember the day that this concept was conceptualized. So my research manager, Marie, who's also obviously we've worked together for a long time, a dear friend. I remember we were just talking one Saturday morning, and I'm just kind of wandering around the kitchen doing things, and we're hacking things about and talking about various things. I had just been to Australia twice, actually, to really look at how has Australia been able to get a really good, Commonwealth-wide perinatal mental health program where every woman gets screened, every woman gets treatment if she needs it, and healthcare providers are trained. And how did they actually get this off the ground? And so, two trips to Australia later, Marie and I were batting around, and I said, what is it about Australia that makes it work? And it just came at that point. It's because they have a centralized system. Everybody in the community goes to the hospital where the midwife is there and screening happens and then care filters out from there. So
Mhm.
there was this central point. And I thought, but we can't do that in Canada. We have disparate provinces and every province is responsible for their own health care. And we just don't have centrality around this. And so we thought, but, if this was online, that could be like an open door to mental health resources that could be accessed from anywhere. Online could be, and it's open door. And so
Yeah.
we started thinking, well, what would it take to build this? And we started asking for funding, or, you don't ask for funding, you compete for funding.
Beg.
Seriously. And we got some money and we started to build this. And 10 years later, the Hope platform is the result. And so it's had a
Wow.
lot of randomized controlled trials behind it. We know it works. We originally built it for pregnancy. And then the last 3 years, we expanded it so that it was all of women's mental health. And it's great. I mean, doctors can give, or midwives, obstetricians, gynecologists, whoever, psychologists can just give basically the link out, and women can have like an open door access to lots of free mental health resources.
Holy cow. And you said free mental health resources. I mean, this is a
Yeah,
huge issue. I love referral partners because, as a doula, I'm with
yeah,
clients all the time, but I can't offer them services like therapy. So I can
yeah,
recognize and refer, but it can take 3 months to even get an appointment. And then
yes,
if you need medication for some sort of postpartum depression or issue, it takes, once you get it, it's another 3 or 4 weeks before you start seeing the results. So these women with something completely avoidable, the system that's completely avoidable can take 4+ months for them to even start to feel better at all. And
yeah,
the obstetricians aren't taking that, they don't see them till 6 weeks. They see them for 10 minutes. And that is a system that they have. I wish it could be different, but the volume of women that they have to see and the time slots they have available and billing and all of that, they can't they're not taking the time and effort to really find out what's happening. So the fact that you've figured out the centralized place to go to get that's huge because there isn't that. That's why pediatricians, my friend who was a pediatrician said her, like, why are these parents asking me about all these things that are not related to pediatrics? Well, they're related to parenting their child. and you're the only one they're seeing. So
Mhm.
it makes sense that parents are asking their pediatricians about mental health for themselves.
Yeah.
But wow, what a huge accomplishment to make that centralized and easier to access.
Well, it's been really such an interesting journey because what we discovered really early on, talking about 2014, we discovered that women really want to manage their own emotional health.
Mhm.
If they are not certain where they're at and they go and they understand that maybe they've got a little bit of anxiety, their natural bent is to manage it themselves, right? We're women. We just want to manage things on our own. We want to try it on our own.
It's
And so
fine.
that,
I got it. It's fine.
yeah,
I
yeah.
got it. I got it.
And so, as a nurse or as a medical professional, you want to say, okay, well, what do we need to do to get them to respond or to come more for visits? What do we need to do to get women to do what we want them to do, which is get care, get help from us? That
Uh,
is truly the way that we're sort of taught and bent as a healthcare professional.
okay.
But our team took that and said, okay, well, what do we do about that then? Well, why don't we just give women what they need to do? And why don't we give them the tools to understand when maybe extra help is needed?
Hmm.
Wouldn't that be good? So that's kind of been the priority of the whole platform and in the book is actually to help
Yes.
them to self-manage their emotional health and then to know and to be informed about, okay, you know what? I'm really tired. I'm not really feeling a lot better. I'm really tired from all the effort and having to do this on my own. I think maybe I need help now. Well, then you've got a willing partner, right? You've got,
Yeah. You
and
saw these women.
hmm,
You didn't
yeah,
try to fit the square peg in the round hole. You just saw them and gave them
yeah,
what they needed.
yes, and absolutely. And I guess the other thing which you've identified, Jennifer, is if we wait for the system to make the changes it needs to happen to help women, it'll be 50 years
Yeah.
or plus. So the system's like a Titanic. It can't turn around like we need it to respond to the needs. So it's like Australia. You know who started that movement in Australia? It was the midwives. They
Yep.
saw the need in
Yep.
their clients, and they started pushing for service and system change. But again, they happened to have at that time a responsive government that was poised and ready to put money in. But here's the thing too about Australia is 10 years later, the funding got cut. And so they weren't training people in mental health care anymore, midwives, family physicians, obstetricians. And so it kind of all hinged on the government's willingness and who's making the decisions. So in a sense, um, informing and empowering women is a resource that's never going to change, right? You're building into women the things they need to care for their own emotional health and to care for their daughters and their sons, right?
Yeah. Which is an interruption. I mean, what you're doing by giving them this resource, what Australia was doing is you're interrupting the generational trauma too.
Yes, yes. We talk about that in the book. I'm very keen on that, we help women to regulate their emotional well-being and then they know and have the skills on how to help their children.
What has it been like raising your boys? They're adults now. So you've gone through the entire raising your kids to adulthood. You've continued to work within this same maternal health. I mean, you've definitely added on a lot of, well, like a PhD. You threw a PhD in there, a couple masters, nothing big. Still so proud. Um, you added all this extra support. You've had the same team. You've worked within this. One, how has it been to raise your boys to adulthood and see them move on in their lives? And then what are some of the great things that you've seen in the work that you've done and how it's really helping people local to you?
Well, it's a double-fisted
It
question.
is double fisted.
Um, Raising our boys has been, you know, the highlight and the joy of my life. You can say that my career looks very illustrious, and it does. And I'm so grateful. I would not have had that career had it not been for my husband. And my father always points that out to me, that he was the one that really supported me through this. And if you read the acknowledgments in the book, I don't have a copy right here, um, but the acknowledgments talk about my husband and I being partners in everything. And that was written months before he died. But it says, we have been partners through all the joys and losses of life. And that was written months ago. But that's our family has been just such a grounding thing for us, coming from dysfunctional backgrounds, a divorce in my husband's family. My mom was a single parent in the 60s. It just
Mhm.
wasn't done. Just all of that kind of brokenness. And then to have a family that actually is close. And now that my husband is gone, I'm seeing that even more. This has only been 2 months since my husband passed away, and I'm seeing the family unity, which is not something I had from a childhood family. Sort of the love and care that my boys have for each other and that they have for me, and their desire to care for me. We live on a sheep farm now. We have over 100 sheep, and so our one son lives here with us and is very much part of the farm. So, um, is that kind of
That's
what?
great. I mean, yes, you broke your own generational trauma with your work and with your family situation and with the partner that you chose,
Yeah,
I
yeah.
feel like.
And I have to be honest, Jennifer, Rob and I were people of faith, not from our family. This came in our adult years. And so that was part of our journey, and certainly a very meaningful part of how we think we ended up where we did. In terms of local, and how this work has helped women, we get testimonies from women, which is so
Mhm.
affirming. Not all research teams get that kind of feedback, but I think we're more than a research team because we're incredibly invested in women's lives with deep compassion. But it's been really neat to see Alberta, for example, many, many, many clinics in Alberta pick up the Hope platform, and be giving it out routinely to women so that women are accessing this constantly. And we have had, for example, Jennifer on a Friday night, one of my team members call me on a Friday night and say, Dawn, you know what? We had somebody connect into the platform. They're feeling suicidal. We need some help for this woman. And so we were able to actually coach that woman to, okay, get her husband, get her in the car, go to Emerge. It's okay. You guys are going to be okay, but you need to get to Emerge now. And, so we've been able to help families at very traumatic parts of their lives too. Yeah.
I'm so grateful for the work you're doing. I think it's really an amazing example to the rest of us who are looking to figure out how can we solve some of the maternal health crisis. So it's such an amazing platform, and thank goodness you get some of that feedback. This work is tough.
Yeah.
And I think those of us in any kind of maternal health really we want to make a difference. We're very genuine and heartfelt about wanting the desire to make a difference. And
Mhm.
that means that you've been able to see like the barometer of what's changing and where things need help. And that's really important. I'm so grateful for you and your story and for coming on. I was very excited to meet with you and I'm so sorry about your loss. Thank
Oh,
you. Thank you for being
Jennifer.
on.
Yeah, thank you. It was sudden and unexpected, and it was a massive heart attack. And from the time my husband didn't feel well until he died was 10 minutes.
Oh,
And we live rurally, so I was there to do compressions and whatnot, but none of the wonderful heroic efforts of our rural fire department, nothing, just nothing brought him back. So he was 62. We thought we had our whole lives ahead of us. We bought the farm 3 years ago, thought that we would have our retirement, living out that part of the vision. But my sons actually, because even though Joel lives in a different province, he's still fully part of our journey forward. We just feel like we're going to carry on and honor the family memory, you know,
Mhm.
honor the family vision. So thank you for
Mhm.
extending compassion that way, Jennifer. Yeah.
You're welcome. Thank you for being on. I appreciate you.
Thank you. Thank you.